Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to cover two simple things you can do now that will slash your risk of developing COVID tomorrow. A lot of things like obesity and quitting smoking and improving overall health isn't something you can do tomorrow or apparently in 8 months. That's not enough time to fix anything. But there are things that you can do immediately to lower your risk as soon as tomorrow. And one of them, so obviously top of the list is vitamin D. The research continues to accumulate that vitamin D plays a role. This shouldn't be a new thing because vitamin D has always played a role in balancing immunity. That means keeping you from getting infected in the first place. That means keeping your immune system from overreacting and keeping it reacting the way it's supposed to. It makes sense. However, all you're going to hear on the news is the studies that aren't as supportive. So one of the ones that seemed to make it out was a study on where they gave hospitalized patients 200,000 IUs of vitamin D, which is a decent dose, but they're already hospitalized. This isn't a drug. It's designed to work with your body, which means you need to start taking it today, not when you're in the hospital. And the other challenge is that England has now recommended that their residents take 400 IUs of vitamin D, which is about 10 times lower the dose than people should be having. So it's almost like public health is caving into this idea that vitamin D is important, but even then, they still can't make the right recommendations. So again, research is never completely solid, but everything right now suggests that vitamin D plays a very strong role. In this one particular editorial or letter to the editor, these two researchers out of Germany estimated that 87% of the deaths associated with COVID were somehow tied in with low vitamin D levels. That's staggering in something that is simple, inexpensive, and safe. It's very difficult to overdose on vitamin D. You can, but you have to deliberately attempt to. And we're talking about something that costs a couple dollars a month to supplement. A couple things, I typically recommend 4,000 to 6,000 IUs a day. That's on top of rational sun exposure. Sunlight does other positive things, not just gives us vitamin D. It also helps with nitric oxide and mood. There's a lot of other factors at play. So again, 4,000 to 6,000. If you happen to not have your gallbladder anymore, then you're going to need to take an emulsified form so that because if you don't have your gallbladder, you're not going to absorb fats very well. And I've had patients who have taken the lower quality pharmaceutical forms and they can't get their vitamin D levels up. It's because they're not absorbing it because they don't have a gallbladder. So something to consider. The other side of things, another thing that you can do, and I've talked about this before, but the research continues to come up again and again. As a matter of fact, in Diabetes Research and Clinical Practice, it just came out today, 3 of the articles were talking about fasting blood sugar and COVID and how it plays a huge role in hospitalizations and deaths. This isn't diabetes, this is poorly controlled diabetes. This is also people without diabetes who have high blood sugar that's higher than it's supposed to be. So blood sugar you can change within hours, certainly by tomorrow, by making some simple changes. And those could be exercising, both strength and short burst aerobic. I'm a huge fan of short burst aerobic. Dietary changes. So eating a low glycemic index diet. So glycemic index refers to how fast sugar shows up in the bloodstream after we eat something. So compare that to orange juice versus an orange. The sugar from the orange juice is going to hit your bloodstream much faster. So looking up low glycemic index foods and eating those and avoiding the high glycemic index foods would can make instant changes in your blood sugar. And lastly, don't drink your calories. That means dairy, that means soda, that means your 1,000-calorie Starbucks drink extra large with the whipped cream and the 15 pumps of syrup. We need to avoid those because they're going to raise your blood sugar. And it's not diabetes per se, it is the uncontrolled diabetes, and it is the probably become diabetes in the future, but it's people who haven't been diagnosed yet, but their blood sugar is still going too high because of their choices. There's a long list of other things that can bring your blood sugar down, but those are 3 things that can do it quickly and can do it tomorrow. So if we truly are worried as a society about COVID, we need to start acting now. And these are things that we can change immediately. So, but unfortunately, we're not hearing this from the public. You know, our list of supporting, of boosting your immunity is limited to wear masks and social distancing, which has nothing to do with your immune system and just your exposure. So boosting immunity is what we need to be talking about. So as always, I will post a link to these 2 studies in the description. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.